Soft drugs in the Netherlands. In almost every country, citizens have strong opinions concerning the ethics of drug legislation. Proponents of legalizing drugs believe the consumption or sale of some or all drugs should be legalized. Many say that soft drugs, such as marijuana, are no more dangerous than alcohol. They advocate for the legalization of small amounts of drugs for personal consumption. Anti-drug activists, on the other hand, caution against the risks of those drugs to both individuals and society. They insist the legalization of drugs correlates with increases in crime, drug abuse, and addiction. What, then, is the truth? The Netherlands has a unique approach to its drug policy. It is directed by the idea that every human being should be able to make his or her own decisions regarding personal health. Dutch drug policy is based on the assumption that drug use cannot be completely eliminated. It also recognizes that there are legitimate medical reasons for drug use, such as smoking marijuana to relieve nausea associated with cancer treatment. Therefore, it distinguishes between soft drugs such as marijuana and hard drugs such as heroin, cocaine, and methamphetamines. These drugs often lead to physical addictions. All hard drugs are prohibited, but laws permit soft drugs to be sold in coffee shops and used in hash bars. Buyers just need to be at least 18 years old, and no more than 5 grams are sold in a single transaction. What are the empirical results of these liberal drug policies? Studies show that decriminalization of the possession of soft drugs for personal use and the toleration of sales of controlled substances have not resulted in higher levels of use among young people. The extent and nature of the use of soft drugs does not differ much from other Western countries. As for hard drugs, the number of addicts in the Netherlands is low compared with the rest of Europe, and they are considerably lower than those in France, the United Kingdom, Italy, Spain, and Switzerland. Contrary to the expectations of some anti-drug advocates, Dutch rates of drug use and addiction are lower in every category than those of the United States. This is in spite of the fact that historically, the U.S. has aggressively tried to prevent any and all drug use by setting severe penalties for using or selling illegal drugs, even soft ones. The lifetime prevalence of marijuana use means the rate at which people use it at some point in their lives. According to the latest comparative figures, in the Netherlands the rate is a little more than half that of the United States. It is about 25% in the Netherlands, compared with 41% in the U.S., and lifetime heroin use in the Netherlands is about a third of that in the U.S., 0.5% versus 1.5%, respectively. Drug-related deaths and the spread of AIDS, acquired immune deficiency syndrome, among drug users are also lower in the Netherlands compared to the U.S., and even compared to other European countries such as France, Germany, Spain, and Sweden. Overall, the Netherlands has the fewest drug-related deaths in all of Europe. Although it is tempting to conclude the lower drug statistics are the result of liberal policies alone, the Netherlands places a high priority on intervention in and prevention of drug use. For addicts who are Dutch citizens or from the Dutch Antilles, Morocco, or Suriname, a former Dutch colony, there are methadone programs to help them quit. These programs have minimal requirements for admission and make very few demands on the clients. This encourages many addicts to seek help. Once addicts are enrolled, the government has an opportunity to share important information on how to prevent the spread of diseases such as AIDS and hepatitis B. Because these diseases are typically spread by infected needles, the Dutch also have a needle exchange program. Intravenous drug users trade in old needles for new, sterile ones. Amsterdam, the largest city in the Netherlands, currently operates 15 needle exchange units. Hundreds of thousands of used syringes are exchanged for clean ones every year, which is extremely helpful in preventing the spread of diseases.